Good afternoon and welcome to Invest in Incredible's presentation of HR policies with COVID-19 impact. My name is Betsy Steiner and I'm the Director of Invest in Incredible here at Gulf Coast Community Foundation. Before I introduce our speaker, Lori Hubner, I'd like to make sure you all are aware of the resources we have available to our nonprofit community. In response to COVID-19, we've launched I3Digital. I3Digital has three key components. First, through our I3Digital website, we have links to vital information, articles, nonprofit resources, and official governmental agency sites that address the current and evolving needs of our nonprofits. Second, I3Digital has pre-recorded and live webinars like the one you're participating in today that address recent legislation, finance and fundraising, and a variety of topics to support the people in and around your organization like staff, board members, volunteers, and donors. The third component of I3Digital is consulting. We continue to offer our traditional consulting services, but in addition, our consultants are available for conversations or short sessions to answer your questions about operating in this unique environment that we're all dealing with. All of these resources can be found on our website, and they are provided by Gulf Coast Community Foundation at no cost to nonprofits in our region. To access any of these resources, please visit our site, I3Digital, at gulfcoastcf.org. You'll see reference to that particular website during Lori's presentation as well. So there are just a couple of things to know about our webinar today. First of all, you can submit questions throughout the presentation. Lori will take questions at the end of each section and at the end of the webinar. Just use the Q&A box to submit your questions, and we'll take them as the questions come up in the different segments. If you have any difficulty with that, just look on your screen for the toolbar. All participants will be muted, so be sure to use the Q&A box for questions. If you happen to get disconnected or leave the session, you should be able to sign in again using that original link for signing in. So with that, I am pleased to introduce Lori Hubner, our I3 consultant and HR professional. Lori has more than 30 years of HR experience serving both corporate clients and nonprofit clients. Her expertise covers all areas of HR, including succession planning, HR strategic planning, leadership coaching, compensation, benefits, anything that you could imagine HR, Lori has expertise and extensive knowledge. Lori, we are grateful for your leadership in this HR arena, and we really appreciate what you've done to put together this comprehensive HR series in response to COVID-19. So with that, Lori, I'm going to turn it over to you, and thank you all for participating.
Great, Betsy. Thank you so much. And I'm also hugely appreciative of Gulf Coast because we all realize that during this really challenging time, HR policies and practices are at the forefront more so than I think they ever have been. So I think we're very appreciative that Gulf Coast is sponsoring these types of programs. And hello, everyone. I'm delighted to be with you today. It would be great if I could see you, but we cannot right now. So that's just the way we have to work for now. And we're just going to continue to really make the best of it. So I'm going to dive into some of the slides and the information right away. One of the things I wanted to be sure everyone was aware of is that this is actually the third out of 4 different webinars that Gulf Coast is offering that are HR centric. The first one, which was Federal Law Alerts, is really all about the Families First Coronavirus Act, emergency sick leave, the expansion of the FMLA policies and the law. That is a recorded webinar, and that is already on Gulf Coast site. The second webinar that's also recorded is Best Practices and Policies for a Remote Workforce. Let's face it, most of us have suddenly found ourselves in a situation where our workforce is absent and you didn't have a lot of time to plan for that. Well, you didn't have any time to plan for that, right? So this helps you navigate through all of those issues about having an absent workforce. This particular webinar is focused on some policies that have some significant impact as a result of COVID-19. All of your policies aren't impacted by COVID-19, only some of them are. So for example, you should still be practicing your good equal employment opportunity practices. You should still be hiring employees, doing your same practices. Your employees should still be filling out time cards, time sheets, payroll systems if they're working remotely. But these policies today have kind of a unique impact in terms of COVID-19. The last webinar that we're planning on is around employee engagement and productivity, and that's really how do you communicate and motivate your employees when they're mostly absent? How do you look now at performance and what does good performance look like for your employees, and let them know what those measurements are. So with that as a backdrop, I am going to review our agenda and then just dive into each of the agenda items. So the policies that we're going to cover today are HIPAA, new hires and I-9 documentation, furloughs, layoffs and recalls, reduction in force, OSHA, workers' compensation, some other legal considerations, and then I'm going to share with you some of the support and resources that I specifically use and that Gulf Coast is continuing to offer to you as well. So let's just, we're going to dive in shortly, but I do have a caveat. And this caveat is really this document and any subsequent FAQs that we post on Gulf Coast website are really intended to provide you with general information and support around COVID-19. Not a lawyer, but I am a pretty decent HR professional. So I think this will constitute good HR advice, but it's not legal advice. I also have one other caveat, which isn't written here. And in terms of your questions, if there's a question that I either need to do a little bit more research on, or I need to know a little bit more about, and I don't feel like I can answer on the spot, we promise you we will get that question answered and we'll get back to you and we'll track those questions. So just a couple caveats as we start to move through the material. We kind of expect this is going to take about an hour, give or take, depending on questions. All righty. So moving on to our first policy that has COVID-19 impact. And this is known as HIPAA, and I hope that most of you know that that acronym stands for the Privacy of Employee Health Information. And you might wonder, what's the implication on COVID-19 right now? Oh my goodness, we have employees with lots of health issues, and this requirement really hasn't changed. So how do you navigate your employees' health issues during this time of COVID-19? So here are some guidelines we suggest that you follow. Number one, if you do learn that one of your employees has been diagnosed with COVID-19, you are still not able to share the specific employee information. So let me pause on that. The specific, by what we mean by the specific employee information is if John Smith on your staff has been diagnosed with COVID-19, then you cannot make an announcement to your staff that, hey everyone, John Smith has COVID-19. So that's what we mean by this guideline, okay? The only thing that employees truly need to know in your workforce is that an employee will be on a leave of absence and not able to work. They may speculate. Let's face it, they speculate when an employee goes on a leave of absence now. But it's not incumbent upon you as the employer to share that information. You should still keep the employee's medical condition and the diagnosis, confidential and private, unless facing true health and safety circumstances. And in that case, we do feel as an employer, you have some obligations to let your workforce know that an employee has been diagnosed with COVID-19. Again, think back kind of the tree of guidelines here. Guideline 1 is you don't announce to your staff that it's John Smith that has COVID-19, but you do share with your staff that somebody has been diagnosed and that as an organization, you are taking the appropriate safety precautions to ensure that your employees are safe in the workplace. In terms of when you could release, whether you could ever say John Smith, it's really never the employer who can say that, but John Smith, it's always their right to release their own diagnosis. So for example, if John felt comfortable announcing to the staff himself or telling the people that he worked with that, guys, gals, I've got COVID-19, then that's okay, but that's coming from John. It's not coming from the employer. So I'm going to pause here because those are the guidelines we wanted to share on HIPAA and see whether or not we have any questions.
Hi, Lori. We don't have any questions at the moment, so I think you can keep going.
Okay, excellent. So then we're going to move on to new hires and I-9 documentation. And some of you are still hiring new employees, which is fantastic. It's great that, we've been able to work out, this remote absent working kind of work and still keep supporting our missions. So that's really good news. I'm in fact recruiting for a few employees for an organization. And so if you are still hiring new employees, you still have to do the same practices, new hire practices, in bringing an employee on your board or into your organization. And those, are things like background investigations, reference checking, pre-employment drug testing, if you are doing those. Those are all still underway and those are all still important to do. Obviously, if your a candidate goes to a clinic, they're going to be following all of the safety precautions in terms of pre-employment drug testing. So all of that can be done by scanning. You can do an offer letter, email it to the employee, the candidate can sign it, scan it back in. If they don't have their own scanning capabilities, UPS is still open. They can go to UPS and scan it into you. There was something, though, very specific about immigration credentialing, also known as Form I-9. And this is the form that requires employers to verify that their new employee is eligible to work in the United States. And the requirements of this credentialing process meant that a person representing the employer had to physically look at the documentation. So it wasn't enough that somebody could send in a copy of their passport, a copy of their driver's license, a copy of their birth certificate. When you fill out the I-9 form, you are also certifying and attesting to that you have physically viewed the identification, that it has the proper certifications and seals. We all know, I think, in the case of a birth certificate, it has to have the raised seal on it. And so that has been the standard that's been in place for I-9 forms for as long as there's been I-9 forms. What the Department of Homeland Security has done in this circumstance is relaxed or deferred the requirements to view that documentation in person. So they are allowing the documentation to be scanned in, copied, sent in to you. You still have to look at the form and get the right proper numbers of documents to prove that that individual is eligible to work in the United States. The one caveat they have, and it's a pretty big one, is that this applies to employers that are operating completely remotely. So if you have some folks still working out of your workplace and your location because they're essential, then you may need to bring in a candidate, practice safe social distancing, practice, I would say in these days, you can't be too careful, wear masks and view that documentation. But if your workforce is completely remote, then you can accept the scanned documentation and forms. Now, when this is all over, and of course, we all hope that this will be all over someday soon, the Department of Homeland Security expects that now you go back to those new hires and those new employees of yours where you view their documentation by a copy and have them bring in the originals, and then you have to reattest on the I-9 form that you have now viewed those documents live and in person. And it is supposed to be within 3 days of the resumption of normal business. I'd like to think there'd be a little bit of flexibility about this, because when it's time to resume normal business, you're going to have a lot of stuff going on. But that being said, this is the guideline in the law of the Homeland Security Department. So I think it was somewhat gracious of them to give us a little bit of a break so that you could continue to hire new employees without having necessarily to face them one-on-one. So I'm going to pause here because this is all I wanted to share on new hires and I-9 documentation, and see if we have any questions.
You must be very thorough, Lori, because we don't have any questions yet. So you're welcome to keep going. And I will say, if it's easier for participants to use the chat feature, you're welcome to do that as well for submitting questions.
Okay, excellent. I think it's good you don't have questions, but honestly, feel free if you do. The next few slides, I'm going to review what's a furlough, what's a layoff, what's a reduction in force, kind of the definitions of each. And then on kind of a final slide on this topic, I have a chart where I'm going to compare and contrast all three of these types of actions. So I'm not going to pause after each slide. I'm going to pause after the slide that has the chart. And just as a kind of a preamble to what this is all about, these are different ways and different methods for an organization to reduce their workforce. So if you find yourself in a position where you can't continue to operationally afford to continue your employees being paid, benefits if you indeed offer benefits, then you have to consider what are the different methods on how you go about reducing your employees. So let's start with furlough. I don't know about any of you, but I hadn't heard that word in a long time. So early in my career, furlough was generally used out in plants for when there were kind of ups and downs in manufacturing production times and so on. And they didn't want to, take employees off of the payroll because they kind of came and went kind of frequently, but they didn't want to pay them. So furlough has kind of come back into vogue as a method during this really unusual time. So let's talk a little bit about what a furlough is. It is an alternative to a layoff. During a furlough, the employee does remain on your payroll. However, it requires employees to take unpaid time off or reduces the number of hours they may work. So here's a couple of examples. If they take unpaid time off, it could be that they're a full-time non-exempt employee who works 5 days a week. And as an organization, one of the methods you're using to get through this really challenging time is to reduce people's work schedules from 5 days to 3 days. And let's use that example for a non-exempt employee, because I'm going to have to give you a red flag about an exempt employee shortly. So let's talk about non-exempt employees. The other choice is, non-exempt employee works 8 hours a day, 5 days a week. Based on the needs of your organization and your business, you want to cut back those hours to 4 hours a day. That's another way you could furlough an employee and reduce the amount of time that you're paying your employees. Again, it's unpaid. It could be hours or it could be days. They stay on your payroll. We'll talk about benefits in a moment if you offer them. And they, for all intents and purposes, they mostly look like an active employee on your payroll. Now that's going to depend we all have different payroll systems and we all have different data points set up as to what an inactive employee looks like. If you don't have a furlough, you might, have an inactive box for somebody who went out on a leave of absence. This would be similar to somebody going out on a leave of absence. They're still on your payroll, but they're inactive because they're not working. So that's headline number one about what a furlough is. Now I mentioned, let's talk about non-exempt employees, because this tool and reducing hours and reducing time is actually easier for non-exempt employees because they are paid on an hourly basis, or their salary is sorted out based on an hourly basis. And they should continue to be filling out whatever time card or time tracking system that you have in place. However, exempt employees need to be furloughed a full work week at a time because of their Fair Labor Standards Act status. So because they are considered to be exempt from overtime and therefore not an hourly employee, the choices that you can make for furloughing your exempt employees are different than your non-exempt employees. Okay, so red flag, exempt employees need to go a week at a time, because you might say, well, why is that? Why can't I just tell an exempt employee I'm going to pay them for 2 or 3 weeks? It's because they are exempt from overtime and you've classified them as exempt, that they are, you are accountable, obligated to pay them their weekly wage, not an hourly wage. So say, for example, you say, exempt employee, you work 3 days now and take 2 days off. By law, you're obligated to pay them for the full 5 days. So it is in your better interest to furlough exempt employees a week at a time versus days or hours. Hopefully that makes some sense. Maybe I'll get a question or two about that. The other point is you could require all employees to be furloughed, or only those employees who do not provide essential services. So my advice is, when you pick and choose employees to continue to work or not work, just always be thinking about consistency. That is really key. You select people based on the work they do, whether it's essential, whether it's non-essential. You don't base it on any other kind of criteria. And I think you all know what I'm talking about, but things like race, sex, disability, you think maybe this person has, is higher risk and they might have a greater chance of contracting COVID. That's not a reason to select someone. So you've got to still take the same care that you would take in any other HR practice when you select. So when you select employees to be furloughed, it really needs to be based on their job and on the services they provide, and whether they're essential or whether they're non-essential. And then how you as an operation and an organization need to reduce the time that you're paying employees. So let's take a moment now on benefits plans. If you do offer benefits plans, many benefits plans, summary plan documents have a requirement about the number of hours worked to be eligible for benefits. So if you have one of those kinds of benefits plans, you need to check with your benefits provider and your summary plan documents in terms of, the number of hours. Because if you furlough a non-exempt employee who's working 40 hours a week to 20 hours a week, you may not be able to offer them benefits. You may, however, be able to offer them COBRA. And the rule around COBRA, I know our nonprofits in this region in Sarasota County are mostly small. So if you have 19 or less employees and you offer benefits, you do not have to offer COBRA. But if you have 20 or more employees and you offer benefits, you are obligated to offer COBRA. So hopefully that makes sense. 20 or more employees, you're obligated to. Less than that, you're not obligated, but it is optional. It's always optional. So if an employer or you as an organization says, gosh, I really feel, even though I don't have to offer COBRA, I'm cutting my employees' time from 40 hours a week to 20 hours a week. I don't want to see them drop from benefits plans, so I'm going to offer COBRA. That's totally your option. It's just that you're not required to if you have less than 19 employees. So I'm going to pause here, Betsy,
Oh, thank you,
and
Lori.
see per chance if we have any questions.
We do have a couple of questions. The first one, could you clarify how PTO is counted when it comes to meeting the work week requirement for exempt staff? Can you kind of talk about how PTO is counted?
Could you repeat that question?
Sure. So when it comes to paid time off,
Yep.
does that count as time to meet a work week requirement for exempt staff?
Yes.
Okay, great, great.
Yes.
So, okay, did you want to expand on that, or is that
Well,
pretty
it's your
straightforward?
policy. So paid time off, um, even though it's not actual time worked, it is time that you've granted employees off. And again, it might depend on the circumstance that you're applying it to. I don't know. I probably have to ask another question like, you know, what's that particular employee circumstance and why would you be concerned about PTO and whether it's applying to the work week or not? I know a lot of organizations have applied for the PPP program, and this webinar is not about the PPP program, but the PPP program does have some requirements about time worked and FTEs. So I know Dan Weiss, and I'm just doing a little marketing here, promotion, but Dan Weiss, another consultant for Gulf Coast, has recorded a webinar on the PPP program. So if that's kind of the underlying reason why that person's asking that question, I might refer them to that webinar.
Great, thank you. We actually have a follow-up question on that one as well. Although I want to go to another one for just a minute. This next question, and then I'm going to come back to a third question. For exempt employees, and we're talking about a furlough based on essential work, what happens, and I'm going to quote the question, what happens if we have two staff who do similar work and overlap? We would only need one employee to continue. Do you furlough them both on opposite weeks, or can you furlough just one based on seniority?
So I would say whenever you select two equal employees for any type of action, you need to use some set of objective criteria. And usually I'm going to talk about skills and jobs first, because at the end of the day, you need to have a certain type of work done or certain type of skills delivered to get your work done, basically. And then I would use seniority second. So if you have two equal candidates and they both do pretty much the same thing with the same skills, and then you need to reduce one of them, I think you have a few different methods you could use. One method could be to reduce both of their schedules. No, you can't because they're exempt. So yeah, I would go for the one on, one off could be a choice, definitely. And in fact, that might be a fair choice. Another choice could be you have two equal employees and you select one of them based on seniority to continue working and the other one to be furloughed for whatever length of time the organization needs that position furloughed. I think those would be the two best alternatives.
Great, thank you for that response, Lori. So I have another question around PTO. Can an organization ask employees to take a couple of PTO days each week, versus actual work time, so the PTO liability for the organization is reduced, and particularly while work is less than usual and employees are not needed?
So generally I'm going to say yes, but I also want to refer back to, for those of you that have not seen the first webinar I did on the Families First Coronavirus Act, the emergency sick leave and the expansion of family medical leave, both of those come with a requirement that you cannot force employees to take PTO time in those circumstances. So that's kind of one bucket. And for those of you and I don't want to go too deep into Families First Coronavirus Act, but there's a lot of different conditions on what makes employees eligible for either the emergency sick leave or the expanded family medical leave. And in each of those circumstances, it's really about either the employee's health situation or the health situation of someone they're caring for, or that the person that they're caring for, the school is closed, the daycare is closed, it's an elder care who isn't going to assisted living, and so on and so forth. I think it's a general looking at your organization and saying, wow, we don't have enough work for everyone to do right now. And a method that we want to apply is to require people to take paid time off and start using up their bank. Yeah, they can do that.
Great, thank you.
Yep.
We have one more question, and that is, does the EFML apply to organizations with less than 50 staff?
I think they mean the FMLA, so I'm going to answer it that way, and that's the Family Medical Leave Act. And the Federal Family Medical Leave Act only was for 50 employers with 50 or more employees. And so the vast majority of our nonprofits in our region never acted, never applied or operationalized that act and that policy in their organizations. Some did by choice. I mean, you could always voluntarily choose to follow something, but you weren't required, to follow it. And I find a lot of the nonprofits I work with, I also do a lot of work in HR policy handbooks and so on. A lot of the nonprofits I have worked with do not really apply any FMLA. What happened in the Families First Coronavirus Act is that they expanded some provisions of the Family Medical Leave Act to employers with 500 or less employees. So suddenly, woohoo, it's everybody. You could have one employee and you are covered under the Family Medical Leave expansion in the Families First Coronavirus Act. And again, that's a webinar that I've already recorded. It's already posted. And there are certain conditions that employees have to meet because, again, it's also about either their health or about the health of somebody that they're caring for, or the fact that daycare closed, school closed, which we all know the schools are closed here. So I'd have to refer them back for that. But yeah, that opened the door. It was like, we didn't have to worry about Family Medical Leave Act before. And now all of a sudden, these expansions are just for employers with 500 and less. The government made an assumption that the larger employers have the resources and the practices in place to help their employees. Maybe they do, maybe they don't, but that's the assumption they made.
Great, thank you. And we have one more question related to furloughs.
Okay.
Do exempt employees still accrue vacation during a furlough?
No. Furloughs, no. Mm-mm.
Okay, great. That was pretty straightforward.
Yep.
Okay, so let's move on, and we'll continue to take more questions as you work through the material.
Excellent. So now I want to spend a few moments on a layoff and a recall. So a layoff is a temporary separation from payroll, generally caused by a lack of work. So this is another method you could apply for reducing your staff and reducing your obligation to pay people, obviously, and to pay their benefits. But this isn't, unlike a furlough where you could, maybe, do it for a certain number of hours a week or some days a week for non-exempt employees or exempt employees a week at a time. This is a separation from payroll. The employer, however, you as an organization, you believe that this condition may change and that you intend to, when the conditions do change, recall the person or persons when work becomes available. A little moment here about unemployment benefits, and I didn't mention it for furlough, so I'm going to cover both. You'll always find the language, employees are typically eligible for unemployment benefits. You will never see an employer committing saying that you are absolutely guaranteed unemployment benefits, and this has been true long before COVID-19. It's important. This is an important point for people to get. Unemployment is the purview of state unemployment organizations. That's every state across the country. They have different unemployment benefits, but it's up to the state unemployment department to really approve benefits. Employers can enable the approval of those benefits, and they enable those in several ways. They enable them by not contesting a pink slip. The reason, the claim, by not appealing the reason for a claim or anything of that nature. So they can enable an approval, but they actually can't make an approval. So I've had a lot of people say to me, and a lot of people are kind of nervous because they're like, oh my goodness, my employer said I'm going to be eligible for unemployment benefits, but then when I actually got my separation letters and information, it says you are likely going to be eligible, and that scared people. But it's same. It's always been like that. And I have yet to see one person be turned down for unemployment right now. They are just pumping through those unemployment applications as fast as they can, and they're approving everybody. So just a caveat about unemployment benefits. Can a furloughed employee be eligible for unemployment? They can. But you kind of have to think about, if me as the employee, if I'm being furloughed for 2 days a week, can I apply for 2 days a week of unemployment? I can, actually. Layoffs, it's very clear. Layoffs, you are eligible for unemployment benefits, and the odds are you're going to get approved. In terms of a layoff, benefits coverage, again, is really up to the employer, if indeed you offer benefits. I work with a lot of nonprofits that don't offer any benefits plans. So for those of you that do, if you have 20 or more employees, you are obligated to offer COBRA. If you have 19 employees or less, you are not obligated to offer COBRA, but it's a choice. It's voluntary on your part if you really want to offer it through your benefits provider. So I'm going to pause here and see if there's any questions.
Yes, Lori, we do have a question, and that is there an issue if all but top executives are furloughed? Is there an issue if all but the top executives are furloughed?
I don't think there's any legal issue at all. I think there's definitely a culture issue and a values issue, for sure. I think what I've seen is organizations whose leadership has taken the steps of not taking salary, reducing their own salary, cutting their own salaries in half. And so I think it's more of a values and a culture issue than it is a matter of policy or law.
Okay, great. Feel free to keep going, Lori.
Okay. Well, here we only have one sentence because this is relatively simple. A reduction in force, often called a RIF, occurs when a position is eliminated, there's no intention to replace it, and it's a permanent cut in headcount. So that's when, typically through reorganizations, through acquisitions, mergers, redundant positions, that's when, this tool for reducing your workforce is more common, a reduction in force. And I'm not going to take a question here because I'm going to go to the chart. And because here we're going to start comparing furlough, layoffs, and RIFs. And then I think I'll pause at the end of this and see what kind of questions we have. So let's look at this chart. So this chart that I've set up has furlough, layoffs, RIF. And let's go through it kind of line by line. So a furlough, unpaid time off, but you're still on payroll. In fact, it's the only method here that you still remain on payroll. Layoffs, you are separated from payroll. RIF, the job's eliminated. You're out of the payroll. Okay. Furlough. Furloughs are almost always for a temporary duration. Now, let's face it, stuff happens with all good intent, and this is a very chaotic time to try to sort out how to be planful and intentional about how you want to minimize or reduce work or so on, because let's face it, we couldn't do a lot of planning. So furloughs, with your best intent, are temporary in nature, and you expect, so it's either hours a week for non-exempt employees or a couple days here or there, or a week here or there for exempt employees. But sometimes it could turn into a layoff or worst case, a RIF as well, you know, if conditions don't improve. But when you're on a furlough, it is intended to be temporary. In terms of a layoff, the duration is expected to be temporary, but obviously no guarantee, and you do remove somebody from the payroll. And then a reduction in force, that's permanent. So those are the differences there. So now you're going to see my words about in a furlough, likely eligible for unemployment during COVID. During normal circumstances, furloughs may not have been eligible to apply for unemployment, but because of COVID, they are. Layoffs are always eligible to apply for unemployment. Even if you get a severance, and RIFs, always eligible for unemployment. And what's always been interesting to me, what I learned very early in my career, is that an employee could receive and you know, it's in the RIF situation that an employee is most likely to receive a severance package. And in that situation, you still can apply for unemployment, you know, and I haven't run across a state that hasn't honored that. So let's now compare time. A furlough could be days or unpaid weeks. A layoff is weeks at a time, you know, or it could be forever. You know, you go into it with your best intent of saying, we think it's going to be 2 months, 3 months, and we're going to recall people, but, you know, you can't really predict your circumstances either. And then obviously a reduction in force is permanent. In terms of benefits coverage, again, under a furlough, it may or may not be provided. It depends on, you know, how many employees you have, whether you're obligated to provide it or not, and whether you so choose to. Layoff, if you have 20 or more employees, you are obligated to offer COBRA. If you have less, you're not obligated, but it's your choice. And the same for reduction in force, is the same benefits approach for a layoff. On a furlough, the employer decides the duration. In terms of layoffs, you know, you should have a recall policy thought through. And that recall policy should be set up in kind of a hierarchy, if I can use that word. And it's generally by job first, skills second, and then seniority. And then with a RIF, you know, it's just, hey, you know, with any good luck, maybe someday, you know, you might be eligible to be rehired because you've left under, you know, a good condition, a good reason, you know, no fault of your own. And if we have openings again in the future, we'd entertain your candidacy. So I'm going to pause, see what kind of questions we have.
Great. Thank you, Lori. We do have a couple of questions. And actually, the first one addresses furloughs. Does the employee have to sign a document, one that's placed in a file, if hours are reduced or if an employee's furloughed, that sort of thing? So do they have to sign something?
So there's no law that says you have to, but I think that's good management practice. And I think that whenever, and I actually think, and you know, what I've seen some organizations doing is a letter to the employee. And I always think documentation is smart and a good practice.
Great, thank you. And then here's another question. Can you give us some examples of salary, wage, and benefit items you could look at to avoid furloughs, layoffs, and reduces in force? You know, we know organizations might be cutting bonuses, maybe skipping market adjustments. Could you recommend some things to avoid layoffs,
Sure.
furloughs, and reduction in force?
Yeah. This dates me back to my corporate life where, you know, we truly would try very, very hard not to reduce our force or lay people off and put in place all kinds of different actions to try to smooth out our finances and, you know, our operations. So certainly putting a freeze on wages, putting a freeze on merit increases, putting a freeze on promotions, putting a freeze on bonuses. If you have any open jobs and you can get by without it, then they're frozen and put on hold. We used to have a process in place that every vacant job was frozen. Every vacant job was on hold, and managers had to make a business case that went up quite a few levels, had to be approved by like the top person for that organization, excuse me, and to get that job approved to be filled. So it was a very high standard. So freezing jobs and holding them open, reducing pay, doing a 10% across the board, doing a 20% across the board. I have heard of a lot of organizations doing that during this. And, I hear mixed feedback. Some employees are grateful that they're still employed, still getting a paycheck, still having their benefits covered. Other employees are, gosh, I think I'd make more on unemployment. Could you just like lay me off or furlough me for a while? So, you kind of have to know your organization, know your workforce when you choose all these different methods, and what would, what would create the most financial relief for your organization, and balance that with what might be the best solutions for your employees. So yeah, depends a little bit on every organization, but I'm trying to think, did I leave any methods out? Well, certainly you should be looking at all spend of any kind, travel, any discretionary spending that goes on, consulting. Oh, look at me, I'm a consultant. But anyways, but yeah, I mean, honestly, we would freeze consultants and all kinds of things. All discretionary spending you could freeze too.
Thanks, Laura. You made an important point, and actually one of our other webinars produced by Dan Weiss also talks about things an organization can be doing to reduce their expenses during this
Right.
COVID pandemic. So
Yeah.
We've had another question come in. This one is related to the payroll protection program.
I'll give it a go.
Okay, and of course, if we need to respond to people after this session, we can certainly do that, because there certainly is overlap between human resource practices and financial practices as well in these particular pieces of legislation. But regarding the payroll protection program, what if you have a voluntary or non-voluntary staff departure during that 8-week period? Can you replace the person and still maintain the PPP as a grant?
So the number one requirement that the SBA, and frankly, it's going to be your bank that's going to check for this, is that of the proceeds you receive from the PPP, that 75% of it went to payroll. 75% of it went to payroll. We have absolutely no guidance or direction, and we don't actually believe this will happen. No one's going to get into the details of how that 75% was paid. You just have to prove at the end of the 8 weeks that 75, if you got $10,000 from the PPP program, that $7,500 went through your payroll system. Who got paid, how they got paid, furloughed or not, voluntary separate. Some people voluntary dropped off, you hired others. There's one measurement, and that's 75% went to payroll.
Okay, great. Thank you for answering that question. I think you can move on if you're ready.
I am. So a couple of kind of finishing up policies here. OSHA, Occupational Safety and Health Administration. And I will say it's been really interesting. I've been reading a lot of articles recently about where's OSHA during this, because OSHA has not jumped in to all of this with a lot of guidelines or direction or anything. So just as a reminder, OSHA actually stands for Occupational Safety and Health Administration, and it comes from the OSHA Act, requiring employers to take reasonable precautions to ensure employee safety. Don't put your employees in situations that could cause serious physical harm or death, and so on. The only guidelines that they have shared during this period so far is to allow high-risk individuals to preemptively begin working from home. And, you know, that's a pretty gentle statement. It doesn't say you must allow or you require. They're basically saying, hey, you know, be flexible, allow, you know, a high-risk employee to work from home, provide hand sanitizer and encourage employees to wash their hands frequently. I'm sure we're all doing that. Clean and disinfect frequently touch objects and surfaces. And if someone at the work site reports becoming ill, disinfect the work area. So there you go. Those are the OSHA requirements so far. I'm going to bring this up now before I head into workers' comp, and then I'll take a couple questions. So communicable diseases, flus, colds, all date back to AIDS, HIV, swine flu, otherwise known as HN1 in 2009. Those are not considered to be work-related injuries. Now there is some guidance going on, right? We don't have guidance or direction yet, but there's a lot of chatter out there that this could change for COVID-19. Because generally you don't really know. I mean, OSHA is all about injuries in the workplace. Workers' comp, which I'll talk about shortly, is about work-related injuries and the insurance that you have to cover for that. And something like a communicable disease, you know, how can you prove that it was actually happened in the workplace? So this is going to be interesting to see how this evolves. It hasn't evolved yet, but I am reading quite a bit right now about it. So I'll pause here before I go to workers' comp and see if there's any questions.
I think we're good at the moment, Lori.
So let's chat about workers' comp. I think we all know that it's, you know, an employee injury or illness under workers' comp if it arises out of and in the course of employment. And important point here, with all of our employees, or many of our employees absent from our workplaces and working from home, regardless of the location where the injury occurs. So does that mean that an employee working at home could have a workers' comp claim? Yep, it does. It does. However, the employee will have the burden of proof that the injury that they suffered at home was work-related. So the employer doesn't have the burden of proof on that, but the employee would have the burden of proof. You know, the employee would have to show that they were acting in the interest of the employer at the time the injury occurred. Courts have found the fact that employers have no control over employees' homes irrelevant. So, you know, employer can't really say, hey, you know, not my gig. You know, how am I supposed to know that, you know, their desk is 4 steps up, you know, on a platform or whatever might have happened, right? And the current guidance that we're hearing and seeing right now suggests that you consult with your workers' comp provider for any COVID-related implications, because again, the chatter out there in the world is that COVID-19 could really test the policy or the premise of what a work-related injury is. Hasn't happened yet, so we would just advise you to have a chat with your workers' comp provider, see kind of what their current thinking is on the topic. Hopefully they might be keeping you up to date about changes as they see it. So I'm going to pause here and see if we have any questions right now.
We haven't had any more come in at the moment, so you can keep going.
All righty. Thank you, everyone. You've had great questions so far. Really appreciate it. So I wanted to take a moment here, kind of more toward the end, to do a couple of questions and answers about some of the common questions I'm getting from many of you and many of the clients that I work with. And so let's start with question one. Can an employer, in the interests of coworker and customer safety, require an employee to go home and return only with a doctor's note, even if employee has used all available benefit hours? Yeah, you can. Number one is you're concerned about safety of your employees in your workplace. So let's talk a little bit about a lot of the testing stuff we've been reading about lately. Thermometer and temperature testing could become a thing, but let's think about that. You know, a temperature in and of itself does not mean that individual has COVID. We could have temperatures for other reasons, but as long as if you're implementing a temperature testing, this is really more a practice to help all of your employees feel safer in the workplace. Doesn't guarantee their safety, because just because someone has a temperature does not mean they have COVID. But it is a step along the way of helping your employees feel like you're doing what you can to make the work environment as safe as it can be without it being perfect. Now, if outside of temperature, if you observe, or a manager observe, or a fellow employee observes someone who is exhibiting symptoms that are flu-like and cold-like, yes, you can. You can invite the employee in. You can say, gosh, you're exhibiting symptoms that concern us about a communicable disease. And so we're going to ask for you to leave the workplace. If the person can work at home, if they're essential, not essential, you kind of have to think through those things. And if they can work at home, they could work at home, but that you can require that for them to return to the workplace, they need a doctor's note confirming that they are healthy to return to the workplace. So that's number one. Number two, can we require our employees to let us know if they are diagnosed with the coronavirus? And how should we ask them for the disclosure? Require is a strong word. I think you can absolutely announce to your employees that in an effort to keep your workplace as safe as possible for everyone, that if an employee has been diagnosed, that you expect them to come forward. Required to me is a strong word because you need to have consequences. So if you require something and they don't do it, are you going to fire them? So what's the consequence of not living up to it? But I think, stating that these are your expectations, and that, also including, that you want to be supportive and you want to, help that individual work through all the types of methods that they could continue to potentially earn some salary, like the emergency sick leave or the expanded Family Medical Leave Act and so on. That would be a good practice. And I think all of your employees would expect, as an employer, that you would make that kind of practice expected. Can we restrict an employee from leaving the workspace on breaks, paid and unpaid, to minimize commingling with colleagues or to help contain the spread of virus? So the guidance here is less about restricting people's movements and more about reinforcing social distancing, washing of hands, using disinfectant and bacterial, stuff and Purell and all of those good things. So the advice here is not so much that you say, okay, employee, you're here for the day. No, can't go out and get your car filled up with gas. No, can't go out and get a takeout Subway. You have to be here all day. The direction and the guidance is more reminding employees, keep social distance. And hey, we've been hearing, I don't know if, I don't think it's Florida, but I do know some of you may know I'm from Connecticut, and I know Connecticut has required now face masks all the time for everybody. If you're outside of your home, you need a face mask in any circumstance. Florida hasn't done that yet, but I do think that's a good practice to expect employees, if they're leaving your workplace, to take all of those good precautions. And that's really the guidance to handle situations like this right now. I have to say, this has been a hugely challenging time in so many ways, but in one of the ways it's been challenging is how much guidance and direction changes. And for some of you that are experienced with the times that the government passes laws that affect employment, you know, they do it with good intent, with the best intent, but they pass a law and then chaos ensues. Because often, usually, you know, they haven't really thought through the implications of how the heck an employer is going to make this operationalize, this new law or this new policy or this new practice in their organization. I mean, Family Medical Leave Act to me is probably one of the best examples of that. They passed this, you know, really big, complicated law and then just threw it out there for employers to figure out how to implement it. And, you know, so there's always, once you're implementing new laws, kind of a trial and error period, kind of a little bit of chaos. And then, you know, we all start getting our arms around what those practices are and what the right ways to deal with it. And then things start to smooth out. And then of course something else happens. But, you know, that's kind of the way it goes. So if you're feeling like this is pretty chaotic and pretty unsettled, yeah, you probably should be feeling like that, because unfortunately that's how this works. Government passes a law. Now we're all figuring out through trial and error how to operationalize it, and then things will smooth out. What I'm hoping, and what Gulf Coast and I have already chatted about, is that in the future, organizations will have a communicable disease policy and program so that we're not caught unawares like we all have been, so that the next time, and I've got to believe there probably will be a next time it happens, that, you know, you can move into operationalizing your communicable disease policy and program pretty quickly, rather than trying all this trial and error that we have going on. I just want to take a moment here, and then I'll stop for questions. And I'm not going to talk for a moment because I'm not going to read the slide to you, but I'd like us all to take about 10 or 15 seconds to read it.
Sorry, I couldn't hear what you said.
Well, that was my watch. So the reason why I put this up here and I wanted to pause, I said early on, the vast majority of your policies really don't change during this. And that is so very true for equal employment opportunity. You should be practicing the same values and the same good practices and policies around treating people fairly, professionally, and with respect, regardless of national origin or race or disability or sex or all of those reasons. So I just think this is a good example and a good reminder that, yeah, some things have changed, but some things haven't changed at all. I'm going to pause and see if there's any other questions before I go over my favorite resources.
Thanks, Lori. We haven't had any questions come in on that section, but for anyone who has questions, feel free to submit them now. And as we're working through the last couple of slides, we're happy to take additional questions.
So I don't know about all of you, but I've been absolutely bombarded with information. I'm sure you have too. And, you know, these are all organizations, consultants, practices of all kinds, associations, all with really, really good intent. I mean, everyone's just trying to help for the most part and support. And yeah, I got to say, some people are trying to drum up a little business too. And so I've been kind of a little bit overwhelmed by it all, because trying to really navigate your way through, because people will write different ways and put different slants on things. So I've decided that I am sticking to the big guys and gals. So the Department of Labor has I think, done a really good job setting up guidelines for employers. So I recommend the Department of Labor site. I obviously recommend the Centers for Disease Control in terms of anything health related in your workplace and so on. I am a big fan. I'm a member of SHRM, Society for Human Resource Management, but what's important for you all to know is you do not have to be a member to access their coronavirus toolkit. They have made their coronavirus toolkit free for everybody. So you could sign on to their site and access all the tools that they've developed under their coronavirus toolkit. And then finally, I guess we all hope OSHA will come up with something sooner or later, right? But I do check them periodically just to see if they've come out with any new guidance. So, but I kind of like right now to stick pretty much to these top-notch best practice organizations and try to unfilter all of the other stuff that I get and I read. And I'll take some more questions, Betsy, or should I turn it over to you? Because that concludes the content for today.
Well, thank you, Lori, so much. We've not had any more questions come in, but if you don't mind advancing to the next slide, I just want to, first of all, thank you, Lori. You did an exceptional job of getting into some important details around these policies. And as Lori mentioned, she has other webinars that are full of really important and helpful information. In addition to those HR topics, there are others, and I've just provided a sampling here. So you can visit the website if there are other topics that are important to you. Lori, if you don't mind advancing to the final slide, I would just like you all to know that if you have any questions for Lori or any of our consultants, please feel free to direct your questions to the i3@gulfcoastcf.org website. We are turning around, in most cases, answers to questions or connecting organizations with consultants within 24 hours or less, and usually it's less. Additionally, the I3Digital site that you see, gulfcoastcf.org, I3Digital, is where we have all of these videos and webinars, as well as the other resources we talked about. So thank you all so much for participating today. I hope you all stay safe and well for you and your loved ones. And again, Lori, thank you so much for a great job.
Oh, thank you. And thank you for joining, everyone. Again, wish I could see you, but stay healthy, stay safe. See you again.